Welcome to Evidence Mastery with Dr. Masood Tusi. I am going to help you understand what lung cancer is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice.
All right, to really get a grip on lung cancer, we're going to walk through it together in 5 parts. First, we'll get the lay of the land, its global impact. Then, we'll dig into what actually causes it. After that, we'll cover how it's found and diagnosed, then move into the really exciting part, modern treatments. And we'll wrap up by looking at prognosis, screening, and, most importantly, prevention.
Okay, let's start with the big picture. Before we get into the details, you really need to understand the sheer scale of lung cancer as a global health challenge.
The evidence on this is just incredibly clear. When we look at all cancer-related deaths worldwide, for both men and women, lung carcinoma is number 1. It's the leading cause. Think about that. It's responsible for almost 1 out of every 5 cancer deaths. That alone tells you why this is such an important topic.
So when we talk about lung cancer, we're not just talking about one disease. Clinically, we split it into 2 major buckets. The first, and much smaller, is small cell lung cancer, or SCLC. This one makes up about 15% of cases. It's known for being highly aggressive, and it's almost exclusively seen in smokers. The other, much larger bucket is non-small cell lung cancer, NSCLC, which is about 85% of all cases.
Now, if we look inside that bigger bucket, the non-small cell lung cancers, we can break it down even further. And this is absolutely critical. The most common type you'll see is adenocarcinoma. Then there's squamous cell and large cell carcinomas. Knowing these subtypes isn't just academic, it completely changes how we approach treatment, as we'll get into a bit later.
So now that we have a sense of the what, let's talk about the why. Why does lung cancer happen? This story is a fascinating mix of our environment, our lifestyle choices, and increasingly what we're learning about our own genetic makeup. There's really no ambiguity here. The evidence is overwhelming. Cigarette smoking is, by far, the main driver, responsible for about 85% of all lung cancers. And it's dose-dependent, meaning the more you smoke and the longer you smoke for, the higher your risk. Of course, it's not the only cause. Radon gas exposure is the second leading cause, followed by occupational exposures to things like asbestos.
But let's go deeper than the environmental triggers. The real story of how a cancer starts is written in our DNA. And the key concept here is something called an oncogenic driver mutation. The best way to think about this is, imagine a car's accelerator getting stuck to the floor. These genetic changes do the same thing to a cell. They give it a constant, unstoppable signal to grow and divide. They are literally the engine that drives the cancer.
And what's really fascinating, from a scientific standpoint, is that different lung cancers have different stuck accelerators. Adenocarcinomas, for instance, are often driven by mutations in genes like KRAS or EGFR. Squamous cell and small cell cancers, they have their own common genetic patterns. The main takeaway here is this. Identifying which specific gene is driving a patient's cancer has become one of the most important steps in modern treatment.
Okay, so this naturally leads to a really important question. How do you even know something is wrong? Let's walk through the common symptoms and then the step-by-step process of how we reach a definitive diagnosis.
The symptoms of lung cancer really depend on where the tumor is and how far it has spread. If it's just in the lung, it might cause things like a cough that just won't go away, chest pain, or even coughing up blood. If it spreads a bit and starts pressing on nearby structures like a nerve, it could cause hoarseness. And if it spreads to distant parts of the body, what we call metastatic disease, you might see bone pain or even headaches. But here's a crucial point. About a quarter of all patients have 0 symptoms when the cancer is first found, often by accident on a scan done for another reason.
So how do we go from a suspicion to a definite answer? Well, it's a very clear, logical process. It almost always starts with some kind of imaging, a chest X-ray or a CT scan that shows a suspicious spot. From there, we usually do a PET CT scan to see if it's spread. But the most important step is getting tissue. We have to do a biopsy. And once we have that tissue, we don't just look at it under a microscope anymore. We send it for molecular testing to find those exact driver mutations we talked about.
All right, this brings us to treatment. And honestly, this is where things have just completely changed in the last 20 years. It's a true revolution.
This question is really the heart of the matter. For so long, the approach was pretty blunt. But now, we've moved far, far away from a one-size-fits-all model. Today, it's all about developing a personalized strategy for each individual patient and their unique tumor.
Let's look at a simplified roadmap for non-small cell lung cancer. You can see how the goal changes with the stage. In the early stages, the goal is a cure, and we typically use tools like surgery or highly focused radiation. For locally advanced disease, we're still aiming for a cure, but we use a more intense combination of treatments. But for metastatic disease, where the cancer has spread widely, the goal shifts from cure to control, and we rely on therapies that can travel throughout the whole body.
So let's talk about those systemic therapies. The classic one is traditional chemotherapy. You can think of it as a bit of a sledgehammer. It attacks any cell in the body that's dividing quickly. That includes cancer cells, but it also includes healthy cells, which is why it causes so many side effects. The new era is all about precision medicine, therapies that are more like smart bombs, designed to specifically seek out and destroy the cancer cells while leaving the healthy ones alone.
And this precision medicine really stands on two powerful pillars. The first is targeted therapy. These are drugs made to find that stuck accelerator, that specific driver mutation, and shut it down. The second pillar is immunotherapy. This is a totally different approach. These drugs don't attack the cancer at all. Instead, they release the brakes on your own immune system, allowing your body's natural defenses to finally recognize the cancer cells as foreign and attack them.
So with all these amazing advances, what does it actually mean for patients? In our final section, let's look at the prognosis, and then bring it all back home with the crucial topics of screening and prevention. You want to see the impact of this new science? Look at this. Before 2004, if you had metastatic non-small cell lung cancer, your chance of being alive in 5 years was less than 1%. Today, that number is around 12%. Now, that's still not where we want it to be, but it's a 12-fold improvement, and it is driven almost entirely by the development of these biomarker-directed therapies. That is progress.
Now, since finding cancer earlier always leads to better outcomes, screening for those at high risk is absolutely vital. The evidence suggests that an annual low-dose CT scan can save lives. The current recommendations for adults between 50 and 80 who have at least a 20-pack-year smoking history and are either still smoking or quit in the last 15 years.
But in the end, after all this talk about amazing treatments and high-tech screening, the single most powerful strategy we have is prevention. The evidence couldn't be clearer. The cornerstone is preventing people from ever starting to smoke and helping every single person who currently smokes to quit.
So that really brings us full circle. The big idea is this. We've transformed the treatment of lung cancer because we finally understand its molecular biology. We've moved from a generalized approach to true precision medicine. It's a paradigm shift that is making a real, tangible difference in people's lives. I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.